We don't have a whole long list of questions, but as a reminder, if people wish, they can type questions in the text box. Once again, we do have this call at 10 a.m., and as a reminder, the call is being recorded, and the recording and transcript of the recording are subsequently placed on our website. Just to give a brief update in terms of status regarding COVID-19 for the people that are supported by DDS. We have to date had 86 people supported by DDS who have tested positive, and of those, as of yesterday, 14 have died. We currently have 31 who are in the hospital. 26 out of those 86 are being monitored. In many instances, they're people who've been asymptomatic from the beginning. And then 15 were in the hospital but have since been discharged. So while it is very sad news to share about the number of people who have succumbed to this, there are a number of people who are receiving treatment and recovering. And just as a sort of overview so that people are aware, kind of the what's not particularly surprising, the two placement types that we have that have the highest percentage of people in those placements who are testing positive are our placements where there are more people living together, which is in residential rehabilitation placements and intermediate care facilities. Both of those, it's about 10% of the population in those that has tested positive. In supported living, it's been 3%. In natural homes, about 0.5%. And our service coordination and nurse consultants are checking in regularly with the folks in their natural homes, monitoring to make sure their health is okay, but also monitoring generally to make sure to see how they're coping with this public health emergency, how they're managing at home, and providing any support that they need. So with that, if we have questions.
Okay, good morning, everyone. Can info go out about the scams related to the paper checks coming out?
So, you know, I think last week when I spoke about the stimulus checks that are being sent to people, I did remind people to be cautious. You know, whenever there's a crisis, there's also, unfortunately, people out there who try to profit from that, who try to take advantage of people during that crisis. You know, a general reminder for people to never share private information over the phone with someone who you don't know. I get calls all the time. These are reminders. It may be particularly acute now, but these are reminders that people should be sharing with folks around you all the time to make sure that when someone calls and, you know, asks for your social security number or your date of birth for some reason, you shouldn't share it unless that's someone who you know and whose call you were expecting.
Are plans underway around the city for opening things up?
The mayor in her press briefing, the reason we do this at 10 a.m. now is so that we're available to watch the mayor's press briefing at 11. And yesterday she actually talked about the work that the district is starting to do. DC is coordinating with Maryland and Virginia and is beginning to look at not just returning to work for the government, but the whole city returning and what that is going to look like. There's a group from Johns Hopkins University that has provided some, that has a report that came out with advice about how to go about doing this, and the mayor and the team that she's working with a team of folks who are relying on that advice in planning for how the city would move toward reopening. As people recall, the mayor extended the stay-at-home order until May 15th. When she did that, she did remind people, or she advised people at that time in her press briefing that she has authority from council already to extend that until June 9th if it's necessary. So as we get closer to May 15th, the mayor will be letting us know whether we're moving then toward opening back up in May, or perhaps not until early June.
When will DDS staff be able to get back to the office? What will keep them safe?
So what keeps DDS staff safe is the same thing that keeps everyone safe. Ensuring social distancing, which means staying 6 feet away from other people. And that means, my description of that, I saw someone that had a bunch of pictures about what that means in terms of how far away 6 feet is. For me, the easiest way to think about it is if I stretch out my arms and the people around me stretch out their arms, we're not touching. So we keep a good distance from each other. We wash hands with soap and water regularly. And I'm learning now, and buy plenty of lotion, because washing your hands all the time dries them out. If you feel sick, do not go out. What we are also learning is that some people do get COVID-19 and either have very minor symptoms or none whatsoever. So any one of us could have it and not know it. And because of that, the mayor also issued an order that when people go out to certain places, they should wear a face covering. The description, as I've said a couple times by the director of DC Health, was whenever you're going to be going somewhere and you're not sure that you can always maintain a safe distance from other people, you should have on a face covering to protect yourself and to protect others. As we start to think about bringing people back to work here, we will be keeping all of those things in mind. We'll be making sure that as the staff transition back to work, that it's done safely. When I first read the question, I'll be honest though, I've talked so long, you may have forgotten the question, when are staff coming back to work? What I think about when I read that question at first is a concern about this coming from a person we support, because I talked a lot last month as we transitioned to 99% of our staff teleworking, that the accent in that word is on the last syllable, work. Our staff are working at home. And so for the people we support, in terms of whether the staff are here in the office or at their homes, there should be no difference. There is a difference in terms of their ability to go out and visit with people. They're conducting those visits either by FaceTime or telephone, so they're not going to people's homes. So you would notice that difference. But ideally, you should not notice the difference of whether the staff are here in the office or not. We are maintaining almost all of our committee meetings. People who participate in those should have a call-in number so they can participate either by phone or by WebEx or by Skype. And so I guess if someone feels like the services they are getting are different and not meeting the standard that you need, that there's some concern about your service, staff are not home, not working. So the same thing would apply. If a staff person, if you have a concern about your service coordinator, anytime you call them, their supervisor's phone number is on their voicemail. Feel free to call their supervisor and that person's supervisor and all the way up to Winslow Woodland, who's the deputy, who gives his number out in these meetings all the time, so I'll share it too, which is 202-730-1618. But as I said, if you're concerned, I would say first, if you're concerned, call your service coordinator and let them know what your concern is. And if it's not resolved there, call their supervisor and move your way right up the chain. Because even though we are not working in the office, people are working. You know, I recognize, I think in some instances, people are even sort of their time is being spent better now than it had been at the office. And I'm seeing people really get things accomplished regardless of where they're working. So we expect the work to go on. And if it's not happening, I really want to know to make sure that the staff have the support they need to be able to do their jobs completely.
Can anybody be tested for this virus? Tested for people we support, at least?
So actually this week, there was a change in that. Up until this week, you can get information about testing on the DC government's website about coronavirus, which is coronavirus.dc.gov, which is CORONAVIRUS.DC.gov. And on there, there's information about testing. Up until this week, the only people who could be tested were people who are currently experiencing symptoms. And not on this call, I don't think, but on our call at 12 o'clock, we have had someone from the DC Health Department who has explained their decision for limiting testing just to people who have symptoms. But as of Wednesday, the guidance in DC has changed so that people who are considered to be people who were defined in the mayor's press briefing as vulnerable or people who are at higher risk for becoming very ill from COVID-19, who have had contact with someone who has been diagnosed with COVID-19 can now be tested. So we are now working with DC Health as well as the Public Health Lab to then reach out to our providers and identify who's appropriate to be tested and offer that testing to all of those people. And we'll be having more information about that very soon.
Can DC do its own thing and not follow Maryland and Virginia because it's much smaller and also have more resources?
You know, DC, Maryland, and Virginia coordinate with each other. You know, a whole bunch of folks who work in DC live in Maryland and Virginia. So each of those, the two states and the city, can't go completely on their own. But all the decisions that have been made in DC regarding COVID-19 have been made based on what's best for people in DC. Sometimes DC has been ahead of Virginia and Maryland in making those decisions, and sometimes I can think of times where Maryland's been a little bit ahead. I think Virginia was the first one to close their schools for the year. So while they coordinate, each of the jurisdictions have made a little bit different decisions, but they do coordinate with each other. But as I say, what's important to know is all the decisions that have been made in DC have been made to ensure the protection of everyone who lives in DC. So we now have a number of questions that relate to sort of they're questions sort of about COVID-19. They're more health-related questions, and so I thought it would be very helpful if I asked Michael Siegelman, who is our nurse educator, if he could respond to those questions. So, Michael, Crystal will ask you the questions for the next few.
Good morning, Michael.
Good morning.
Is it okay for people not to be wearing masks when they go outside? I see a lot of people in my neighborhood not wearing masks.
A direct, quick answer to your question is that there isn't a rule requiring people to wear masks when they're walking outside. Is it okay for people to do this? That opinion can differ from person to person. There are many people in my neighborhood who don't wear masks either. The mayor's April 15th stay-at-home order states that people are required to wear a mask to visit an essential business like the grocery store or the pharmacy. And this order is different compared to when you're simply walking outside. The person is required to put a mask on at that time when they are doing essential business visits. The masks are to decrease the risk of transmission, meaning the risk of the likelihood of getting COVID-19, and that people wearing the masks are protecting others in case the mask wearer has COVID. So the mask benefits the people around the mask wearer by hopefully decreasing that likelihood of transmission or of getting COVID-19. The mayor also stated that social distancing is still encouraged and masks do not replace that social distancing. So when you see people outside walking without a mask, distance yourself as you always do from everyone else, but especially then. And as Andy said, when you stretch out your arms and the other person stretches out their arms, your fingers don't touch. That, I think, is the best way to describe social distancing. That is about 6 feet apart. When I go outside and someone isn't wearing a mask, I've found that most people in DC step aside or step onto the grass to let people by and to allow for that social distancing. I personally sometimes turn my head to the side so I'm not passing the person. That's just me. But to summarize again, it's essentially allowed for people to walk around outside without a mask. It may just not be okay for you in your opinion, but it is allowed.
How often should we wear the mask? A week and then dispose, or one day? Wash or what? For cloth in the standard blue-white mask.
So regarding the blue and white masks, they're called medical surgical masks or medical surgical procedural masks. I would recommend that you speak with your provider to ask what supplies are available and how often you should change your mask or discard the mask based on how long the supplies will last. Masks, cloth masks should be washed when they get wet or moist from your breathing, or you can wash them regularly depending on how often you would use them. If you have a clean, unused mask and you didn't go outside for a few days, then the mask can be worn that day and it doesn't have to be washed immediately beforehand. That's because it isn't moist from your breath and it isn't used. I would say at a minimum, the masks should be washed daily, the cloth masks. The cloth masks routinely washed depending on the frequency of that use. I just repeated myself, I'm sorry.
Cloth masks are causing me to sweat. Can I get a different one?
So there are a number of ways to make the cloth masks. And I can send a link to Andy, Kirk, and Crystal on some things that I found about how to make these masks. It may be the number of layers or the material that you've used, and changing that could decrease the amount of sweat you're experiencing. I have to say though, if you can bear the sweating, if you can handle the sweating, maybe bring a rag to wipe off the sweat, and definitely stay well hydrated. My question would be, could you endure some of that sweating? If not, I recommend trying different ways to make that mask, and I'll send that link.
Can you explain the antibody test? Is that an option?
According to the CDC, the evaluation for the serological tests or the blood tests are going to arrive in late April. I have to say that I don't know many details about the antibody test, but I can tell you how it works. It looks for things in your body, antibodies in your blood. Your body makes these to fight the infection. And the same thing would happen when you get a vaccine like a flu. You develop these antibodies. That's how you develop this immunity to the virus, or not being able to get the virus again. The antibody is not checking for the virus itself. It's just checking to see how your immune system responded or defended itself against the illness.
If you go shopping, am I not supposed to open the bag for 2 days? Do I have to clean food, etc., with Lysol first?
So I haven't heard anything about not opening a bag for 2 days, but the CDC states that there isn't much evidence or research for that matter on the food and virus exchange transmission. Personally, I do know a number of people who clean everything before they bring it in, before they store it away in their kitchen. They clean containers, glass and plastic containers, things that the EPA approved disinfectants are allowed to go on without permeating through, without going through the product. But as far as specifically recommending it, that is not something that you need to do. It doesn't hurt. As I said, I know many people who do it, but you do not have to do it.
And at this time, I want to ask anyone who has any additional questions for Michael, if you can type that into the chat box at this time. Or you can call Charlisa Payne at 202-442-8411, and she could type that in. So again, that's 202-442-8411, and ask Charlisa to type the question in for you.
Crystal, I see one that someone wrote. Do you want me to just answer it, or okay? It says, aren't veils and bandanas more sanitary and cleanable than masks? Why do authorities insist on makeshift masks instead of veils? So I'm not quite sure the definition of veil, but I can visualize the bandana. And I don't think there's a question, I don't think there's a change in the sanitary or cleanability of cloth masks versus a bandana, like a mask that I've made with a shirt to put over my face versus a bandana, unless I'm misunderstanding your question. It should be the same. Both can be cleaned. If you are referring to the blue and white masks, those are just thrown out and replaced.
Okay. Can people get corona from pets?
Andy, is that for me or for you?
That's for you, Michael.
Okay. So I've read a number of things because I do have a dog. You know, I have coronavirus. If I have COVID-19 and I sneeze and I pet my dog, virus is on my hand and it goes onto my dog. I don't know a lot about the transmission or how long it can sit on our pets. but it is smart after petting your dog or someone else's dog to wash your hands before touching anything, especially your face. Crystal, should I include my link right here, or should I wait and send it to you?
Hi. Hi, everyone. Any other additional questions for Michael at this time? And sure, Michael, you can add that link into the text box.
Okay, sorry to interrupt. I'll send that now.
Okay, all right. So it doesn't look like we have any other questions.
So I've seen a couple of people ask, and I'm sorry I should have included this. One of the things that is required now by the mayor's order is that all provider agencies report to us the names of staff who have tested positive. So we are getting more accurate data and more complete data on that now. So we have to date had 75 people who work for provider agencies in various roles who have tested positive, and 2 people who work for provider agencies who have died from corona.
Okay. Are the stimulus COVID checks considered income?
No. So for people who are concerned about, the way Social Security calculates income, it's just like it is handled just like any back payment that Social Security makes. It's not income, and you have 12 months to spend that before it counts against your assets and resources.
Does DDA have a plan on how to distribute stimulus checks to SSI recipients who it serves as rep payee?
Yes, we are beginning to receive those now. So as we receive them, in the same way that currently we pay over a portion of the SSI or SSDI, we'll be including this in that portion that is paid over.
Can we get an update on when contribution to care checks will be able to be deposited?
Oh, I'll give that to you. I mean, I can tell you. So I guess it'll be easier. I'll just tell you right now. I was going to email you yesterday. Rather than mailing those to OCFO, they should be mailed to DDS at 250 E Street Southwest, Washington, D.C. 20024, and put to the attention of Andrew Reese. And we have worked out with our agency fiscal officer the process for getting them over to OCFO so that they get deposited. OCFO does not have someone regularly at their office, but we do because we have other checks that are regularly coming in as well. So rather than mail anything to them, mail it here to my attention, and I will make sure that our AFO processes it.
Also, an update on payments of people's personal needs allowance.
I don't think anything's changed in that regard. There should be no change regarding personal needs allowances.
I suppose DSPs are vulnerable people. How fast can they be tested?
So just to be clear, when we speak of vulnerable people, what we're talking about is people who are at higher risk. of having a more serious response to COVID-19. And that would be people, the mayor said the other day over the age of 65, I thought it was over the age of 60, people with other underlying health conditions, respiratory issues, heart disease, diabetes, obesity, but there are a number of different underlying health conditions that cause a person to be considered at higher risk and a vulnerable person as it relates to COVID. So in that regard, no, DSPs would not be considered high risk in that regard.
There have been delays in people in respite getting their personal needs allowances before the need to send paper checks. Which steps has DDS taken to address this problem?
I'm reading it again to understand what this issue is. So, is this an issue of a question about our ability at this time to send out paper checks, I assume? So if there are issues with getting any kinds of payment, then you should give Jared Morris a call at 202-730-1548, and he'll address that for you.
A recent mayoral briefing indicating that DC is deploying rapid coronavirus testing kits to certain homeless shelters, corrections facilities, and St. Elizabeth. Are there any rapid coronavirus tests being provided on site to people receiving DDA supports?
So this is what I was discussing before. On the day that the mayor announced the change in testing, she also announced that there were a number of devices available to do the rapid testing, including available to long-term facilities, and that includes the ICF and ResHabs for DDS. So we will be working with, that's where we're working with DC Health and the health office here to identify which people would be appropriate for testing. While they're not technically considered long-term care, we will also be including supported living for people who are considered at high risk and have had a contact.
Will providers be notified when a shared member is exposed to the COVID-19?
So we actually this week had a meeting with EPI at DC Health to address this issue of making sure. Will they be notified by us? No. So because that's a public health responsibility in terms of checking in to make sure that. So what happens is when a person tests positive, the public health department works with that person and makes sure that the person is aware of the risk of transmission, make sure that they're aware of any obligation they have to self-quarantine, and if there are any concerns about it, they then follow up. We have been gathering from all of our providers the list so that we know who works at more than one place, and when we have any concerns like that, we would turn it over to the epidemiology department at DC Health, and they would follow up with it. But yes, we have looked into that, and we are working with DC Health on making sure that we have a response. It was very helpful that the mayor's order last week included the requirement that providers give us specific information about staff who test positive. There would have already been a requirement. When the lab gets the positive result, they send it to the local health department. But this is just an extra step to make sure that we are aware of who they are and making sure that they are taking steps to protect themselves and others.
There is an issue, this is a comment, there is an issue with people in respite getting their P&A.
So please follow up with Jared about that.
My son gets SSI and he's afraid that he will not get his money. What do I tell him? He gets direct deposit.
If he gets direct deposit, there should be no reason to be concerned. Direct deposits are going through as they've always gone through. And if you're talking, when you reference his money, if you're talking about the stimulus funds that are coming, if he's entitled to a stimulus check, those have also been coming through.
Will SSI recipients have a say in how they spend their stimulus checks?
It's their money. So, yeah. I mean, the issue is going to be, for folks supported by DDS, they work with their provider to make sure that while you have 12 months, you know, that it doesn't count towards your assets for 12 months, you do need to make sure that, just as normally, that you're monitoring how much you have in the bank to make sure that you don't go over, that you're not over-resourced, that you don't have too much money in the bank to then make you not eligible for Medicaid. But the staff who work with people on that regularly would work with them on this for the stimulus check.
Who gets and what about notification of families if persons or their staff test positive?
Hi, Carol.
A good question. That's a very good question. If a person tests positive, very clearly everyone is being notified. If there's been a contact, that has not been the practice to notify the sort of circle of support that the person had a contact and was being quarantined. But it may be something that we should be talking about, whether that should be a practice to make sure. The truth is, when this started, which feels like a very long time ago, if you were in contact with a person who had tested positive for COVID-19, you were told to quarantine at home for 14 days and monitor your symptoms. Now, we're doing pretty much that with everybody anyway. So everyone, you know, we are monitoring folks' symptoms. We are keeping everyone at home. So now the difference, of course, is if you have had a contact with a person, you shouldn't be going out even for essential reasons, except there are some circumstances where that does still occur. But if you've had a contact with someone, then there's guidance about self-quarantining. And it is a good question, and we should discuss that further, whether part of our protocol should include making sure that the family is aware that the person has had a contact, and reinforcing the need for that person to self-quarantine, because there are some more limits placed on you when you're self-quarantining, including being cautious about face covering, you know, in the event sometime during that 14-day quarantine period you present any risk of transmission to someone.
What is the process that being held with cases or caseloads that has been in process with your office and has been having complications receiving information? What is the...
I'm really not understanding the question. There's nothing different in terms of DDS's case management process currently. In terms of applications for services, provision of services, we're addressing some issues right now for applications. If there's a need for additional evaluation, how we go about getting that, given the need for the social distancing and the ability to get necessary evaluations done in that light. But if there's any concern about someone's services, they should contact their service coordinator or that person's supervisor.
All right, are there any other questions? Please type your questions in the text box or contact Charlisa Payne at 202-442-8411. Again, 202-442-8411 if you need to call in. How many consumers have been affected by COVID-19?
So at the beginning of the call, I did go over the number of people who have tested positive, which is 86 people who have tested positive, and I broke that down quite a bit. Affected by? All of them, I would have to say. We have also had an additional 206 people who have had some contact with a person who has tested positive. And so those are in various stages of monitoring the person to make sure that they don't convert to having COVID-19 themselves, that they have not contracted it, just that they had contact. That also includes people who've passed the period, the 14-day quarantine period, but we have monitored 206 people who have had contacts with people and had to self-quarantine, so they've certainly been affected.
Okay. Any other questions? With the COVID-19, have there been any difficulty getting confidential information processing in a timely manner?
No. So one of the responsibilities of our agency is doing the medical determination for processing disability determination claims for SSI and SSDI, and we were actually part of a group that was doing a pilot for that beginning several months ago. And so we already had all the equipment in place, the encrypted, we had like the level of security on the laptops for all of the staff was already there. So folks working from home, there's been no issue with privacy. As people know, we have encryption on our email. People don't always like the encryption on our email, but that's one way of ensuring people's privacy. We do not use Zoom because there have been concerns about privacy when using Zoom. And we make sure that in transmitting any information, we're doing it only through a secure site. Any staff that work from home, that use their computer, have to ensure that they have virus protection software so that it is protected. So we have a lot of measures in place to make sure that there aren't concerns about confidentiality or privacy.
Any additional questions? And we also just want to remind everyone that the community forums are recorded, as well as we have the transcript posted to our website.
So I don't know if Michael's still here. The person has a question about whether you can get coronavirus from touching paper money. The one thing I didn't say earlier when I was talking about prevention is not touching your face. So keeping in mind, if you touch anything, and, you know, this is true when you touch money generally, you don't know where that money has been. You should always wash your hands. The thing about coronavirus is it's just reminding us of good hygiene practices that we should have all the time to keep us healthy, including regularly washing your hands, avoiding touching your face, especially if you didn't just wash your hands. Avoid then touching other surfaces. You know, like if you don't need to when you walk down into the metro, if you need to use the railing to walk down the steps, do that. If you don't need to, don't touch surfaces as much as possible. But if you do, wash your hands or use hand sanitizer, and don't touch your face unless you've washed your hands, and keep your distance from people.
Michael, we've unmuted you. There's a question here. Can people get corona from paper currency or cash?
So just to echo what Andy just said, and moving along with the paper currency and cash, I have seen many businesses where I live where they are not accepting cash. So I think because the coronavirus is this COVID-19 is so new and there's so much to learn, they're not sure, but businesses aren't accepting cash in many places near me. I don't see why you couldn't get it if I had COVID-19 and I sneezed and touched paper and then handed it to Crystal, the virus would be on the paper. So echoing what Andy said, don't touch your face at all. Wash your hands. If you have an itch on your face, wash your hands first. If you have to blow your nose, wash your hands first. And remember, we said this a few weeks ago, washing your hands for 20 seconds, which is the happy birthday song twice. That's stated on CDC and on DC Health. So sing yourself happy birthday every single day, multiple times a day. It's something that'll cheer us up a bit in these times, I think. And if you use hand sanitizer, your hands must be dry by the time you are done rubbing your hands. So at least 20 seconds or until your hands are dry. So you keep rubbing. You want to put a good size amount of hand sanitizer on your hands if you are using hand sanitizer instead of soap and water.
So it seems that there's a person who has lots of questions about services at DDS and supervision of case management. I'll repeat again, when people have concerns about service coordination from DDA, please call your service coordinator or their supervisor, but all the way up the chain, if you are not satisfied, the deputy director for DDA is Winslow Woodland at 730-1618.
Okay, we'll hold for additional questions.
Okay, it appears Is the city council building open? They ought to all be working remotely, but I honestly don't know. You could check their website, or whoever it is you wish to see over there, you should give them a call. I don't think they're in their offices, so you might want to communicate with them some other way. I would call them on the phone. I expect there'd be a message indicating how to get in touch with people. So thank you, folks, for joining us today. As a reminder, this was recorded and will be posted on our website along with the transcript as soon as it's available. And we will talk to people again next week.